Hello, everyone. In this section, we will continue to learn about upper gastrointestinal hemorrhage. It is very important to clarify the cause of upper gastrointestinal hemorrhage because it involves treatments. We have already studied the etiology and clinical manifestation of upper gastrointestinal hemorrhage. So, how can we find the cause in patients? We usually use the following four methods. First, we can analyze the patient's clinical history. If the patient has chronic, periodic, and rhythmic upper abdominal pain, we should pay attention to the presence of peptic ulcer. If the patient has a history of viral hepatitis, a long history of alcoholism, and a history of liver disease, we need to pay attention to whether the UGH caused by rupture of esophagus varices. If the patient takes NSAIDs recently, or under stress, or had a major operation a few days ago, we must consider the possibility of acute erosive hemorrhagic gastritis. Well, a middle-aged and elder patient was recently lost weight and has repeated upper abdominal discomfort, we should be alert to the possibility of upper gastrointestinal tumors. The second method, which is also the performed method for diagnosing the cause of UGH, is endoscopy. When the patient condition permits, the patient is usually required to have no shock and can be tolerate the examination. We should conduct an endoscopy as soon as possible to determine the cause of the bleeding. Performed within 24 to 48 hours after bleeding is called emergency endoscopy, which can improve the accuracy of etiological diagnosis. Because some lesions can heal in a short period of time without leaving traces, it is difficult to find after the acute phase. Endoscopy can directly observe the bleeding site, determine whether to continue bleeding or assess the risk of bleeding, and it is also a very important and effective treatment. In addition, imaging examination is also one of the important means. X-ray examination can find the intestine diverticulum and the larger tumors, but this examination is not suitable during acute gastrointestinal hemorrhage. Abdominal CT scan has certain diagnostic value for patients with abdominal mass and intestinal obstruction. In addition, imaging examination is also one of the important means. X-ray examination can find the intestine diverticulum and large tumor, but this examination is not suitable during acute gastrointestinal hemorrhage. Abdominal CT scan has certain diagnostic value for patients with abdominal mass and intestinal obstruction. Selective angiography is feasible when no bleeding lesions are found by endoscopy and arterial bleeding is estimated. If you see contrast agent overflow, it is the most reliable sign of gastrointestinal hemorrhage, and you can immediately give a transcatheter embolization to stop bleeding. But when the amount of bleeding is small and the speed is very slow, it is difficult to find out in this way. Another method is surgical exploration. When various examinations cannot identify the bleeding site and the continuous mass bleeding endangers the patient's life, surgical exploration should be performed. Some small lesions, especially vascular lesions, are not easy to be found by surgical exploration. At this time, intraoperative endoscopy can be used to help find the bleeding lesions. After we find the causes, we need to consider appropriate treatment. In the next part, we will talk about it. First of all, we still need to know the general treatment given to patients. They should stay in bed, rest fully, and avoid activities. At the same time, it is necessary to ensure that the patient's airway is unobstructed. Avoid suffocation during hematemesis and inhale oxygen if necessary. They should be fasted during active bleeding because eating may worsen the condition. The doctor should monitor the patients closely, monitoring changes in vital signs, clinical manifestation such as hematemesis and black stool, urea volume, and consciousness, and the laboratory indicator, for example, the changes of HB, RBC, HCT, and urea nitrogen, etc. Massive hemorrhage of the digestive tract is an acute condition and changes rapidly, which may be life-threatening. Anti-shock and rapid blood volume supplementation retreatment should be placed first in all treatment scenarios. So, we should establish effective intravenous infusion channels and supplement blood volume as soon as possible. When the patient has these three conditions, we should infusion of concentrated red blood cells. Of course, for fasting patients, we should also give intravenous nutrition support treatment. Then let's take a look at the core content in treatment, which is the part of hemostatic measures. Due to the different causes, the treatment methods are slightly different and focused. So we divided treatment of UGH into two types. One is the treatment of non-varicose bleeding, and the other is the treatment of varicose bleeding. Among them, we have already studied the treatment of varicose vein bleeding in causes related to liver cirrhosis. Let's review briefly together. We have 5 methods to treat varicose bleeding. We can use drugs to reduce partial pressure, such as somatostatin, terlipressin, etc. Since taken Blackmore tube with 2 balloons can stop bleeding by compression. Under endoscopy, endoscopic injection sclerotherapy, endoscopic vasodilation, or tissue adhesive may help to stop bleeding. TIPS has the advantage of less trauma, faster recovery, less complication, and a defeated curative effect. With the development of many more invasive techniques, splenectomy or shunt is rarely used. In this course, we will focus on the treatment of non-varicose bleeding. Currently, there are 4 ways to treat non-varicose bleeding. They are drugs, endoscopy, intervention, and surgery. Let's get to know them one by one. The main purpose of our use of drug therapy is to inhibit gastric acid secretion. We can choose proton pump inhibitors or H2 receptor blockers, but clinically we use PPI more. Why can inhibiting gastric acid secretion play a role in hematemesis? That is because the hemostatic effect induced by platelet aggregation and plasma coagulation function can only be effectively exerted when the pH is more than 6, and the newly formed clot will be quickly digested in gastric juice with pH less than 5. Therefore, inhibiting gastric acid secretion and raising the pH volume in the stomach have a hemostatic effect. Endoscopic hemostasis methods include injection of drugs, thermocoagulation, and mechanical therapy. Vasoconstrictors can be used for injection. Thermocoagulation treatment can choose APC, high-frequency electrocoagulation, thermal probe, or microwave, and so on. Mechanical treatment mainly use mental clip. Its function is similar to suture. We mentioned interventional therapy before. When the endoscopic treatment is unsuccessful, the gastroduodenal artery can be embolized by vascular intervention, and the collateral circulation between the blood supply arteries of the upper digestive tract is rich, and the risk of tissue necrosis after embolization is low. When the above method fails to stop bleeding, and continuous bleeding may endanger the patient's life, we can also consider surgical treatment. According to the etiology found during the operation, give appropriate treatment. Okay, that is all we need to learn about upper gastrointestinal hemorrhage. Thank you for your attention.